Hello to all of you. My name is Rebecca Sweeney, and I work as a Senior Director of Programs and Policy for the Wisconsin Cheesemakers Association. And I want to thank you all for making time to join today in this webinar focused on Delta variant outbreak prevention strategies in workplaces. Throughout the pandemic, WCMA has endeavored to provide members with timely, actionable information to safeguard their workforce and to maintain their operations. A key partner in our efforts has been the very professional and dedicated team at the Wisconsin Department of Health Services, and in particular, today's featured speaker, Dr. Jonathan Meiman, who serves as Chief Medical Officer and State Epidemiologist for Environmental and Occupational Health. Can't do better than talking to Dr. Meiman. In today's concise and solutions-focused webinar, Dr. Meiman is going to detail the latest statistics on the spread of the Delta variant, the risk that this strain poses in your work environments, and actions employers may take to minimize its impact on their operations and again, on their workforce. He's also going to be fielding questions from you. Many of our members submitted questions in advance, and we're going to begin with those questions at the end of his presentation. But we're also happy to accept additional questions based on what you hear today. I would encourage all of you to use the chat function. If you'd like to pose a question at the end of today's webinar, simply message that to me. All questions will be posed anonymously, so we won't say your name or your company, just to give you that measure of security. So it's my pleasure now to welcome Dr. Meiman. On behalf of WCMA and all of its members, we thank you for your work, and we thank you today for your time and expertise.
Yeah, I really appreciate the invite, and thanks for coming on at such short notice. And it's good to see so many people here today. So that was a kind of nice high-level overview of what I want to be talking about today. And I'm going to keep it pretty brief because I want to leave plenty of time for Q&A. But really, just we're kind of in the middle of a rapid change here with COVID-19, and so I want to get people kind of up to speed as quickly as they can because it can be hard to keep track of what's going on. So I really just wanted to start with this map right here. I think this is probably the starkest example of what we're facing as a country as a whole. As everybody recalls, back in the summer, things were looking very good on the COVID-19 front. We were getting vaccines out. The level of transmission was dropping dramatically across the country, including here in Wisconsin. And in this kind of county by county map that shows the level of transmission by August, things had completely changed. And this is driven kind of in part by two things. One is suboptimal levels of vaccination and the Delta variant. And so that's what I want to talk about here. So as you've heard, I'm sure watching the news, the Delta variant is something that's got us very concerned in public health. And without getting into kind of the details of it, it's a new strain of the virus that causes the disease called COVID-19. And the reason we're so concerned about this is because it spreads much faster than the original strain that was being passed around kind of earlier this summer and last year. It looks like it's about twice as contagious as the previous version of the virus. So it spreads very quickly. And we're seeing some emerging evidence right now that it actually may also cause more severe disease. So that's a really, I think, troubling combination there of a virus that's more deadly and spreads much faster. So this is an example here of just how contagious it is. This is a simple graph just looking at different types of viruses, and kind of on that vertical axis, we have how deadly the virus is. And on that horizontal axis, we have how easily it spreads from person to person. And you can see that big blue box there, that SARS-CoV-2 Delta variant, that puts us kind of in the range of somewhere around chickenpox. And as folks on this call can remember, if they were born before the era of vaccination, chickenpox spreads very rapidly. And even more concerningly, of course, this is much more serious illness than things like the seasonal flu. So Delta is by far the dominant variant here in Wisconsin. These are some numbers from CDC looking at the Midwest. Over 99% of the virus now here in the Midwest is the Delta variant, and the numbers from Wisconsin specifically show the exact same thing. So if you get COVID-19 right now, it is the Delta variant. That is what's spreading, and it spreads so easily, it's driven out all the other variants here in the state. So reasons we're worried is we're seeing some early indications, because we do track the number of outbreaks. We're seeing some early indications that the number of outbreaks reported in businesses are increasing. If you recall back to last year, some of the earliest outbreaks we saw were in food processing, just because of high density in close quarters in some of those. And we're seeing some early indications now that we're starting to see more business outbreaks. Spread is also a concern because it can be particularly rapid indoors. This is going to be more of a concern as we move into the fall and winter. People spend more time. It's hard to get outdoor ventilation in. And of course, unvaccinated workers, if you're unvaccinated right now, you're at serious risk for severe health outcomes. And then as this spreads through the workforce, through whatever means, there's potential for worker outages that can threaten business continuity. So what do we do to prevent it? Well, this is the main thing I wanted to kind of drill in on today, is the things that we know that worked before continue to work now. It's more contagious, it spreads more rapidly, but the tried and true strategies still work. As you probably, I'm sure all of you have heard, the masking recommendations from CDC recently changed. We emphasize now that anytime anybody is indoors with in a work environment, or not basically with family members, that they remain masked at all times. Staying home when ill is key. People can be very mildly ill, but they can still spread it to others, who will then end up having a more severe case of illness. Testing, the importance of testing is just reemerged. So community testing sites are now seeing record volumes in parts of the state. I know a few businesses that I have close contacts with have done a really good job making testing readily available on site to employees. This is much more feasible now with cheaper rapid testing that can be done on site. It's important to get people who are symptomatic tested by whichever way you can do that quickly, or people who are exposed. And the same thing goes back to contact tracing. I know it's challenging, particularly when you have a illness that spreads this quickly. But if people are working with another group of people on a routine basis, making sure they get tested as well and out of work for a brief period of quarantine. And then of course, vaccination, and that's what I want to talk about some more. So when it comes to vaccination, two key messages I'd like you to walk away with today. Communicating with your employees about the benefits of vaccination, and then increasing access to it. So in communicating, three key messages I want to drive home. One, that they work. Two, that they're safe. And three, that they are free. No ID is needed. So we want to make them as accessible as possible. So how do we know that they work, and has this changed at all with the new Delta variant? So what hasn't changed is we know vaccine is very effective for preventing severe illness. So people who get vaccinated are about 89 to 100% less likely to be hospitalized or die from COVID-19. They're also very effective at preventing people from getting sick. And this has changed a little bit with the Delta variant, in the sense that people may be more likely to get it if they are vaccinated, but it does prevent severe illness, and that's our goal here, is to prevent people from getting seriously ill. And it also can protect you, and of course everyone around you, from getting sick as well. So this is, I know there's been a lot of talk about what is the impact on Delta, what is the impact from waning immunity, right? So some people are many months now into their vaccination. How well are the vaccines holding up at preventing these serious outcomes? This is data from our state here. So what you're seeing is Wisconsin specific. And kind of walking from left to right, you can see that for people who are fully vaccinated, they have a 30-fold reduction in even being diagnosed with COVID-19. The rate of hospitalization is 22 times lower, and the mortality rate for people who are fully vaccinated is 36 times lower. So these vaccines work exceedingly well, I think much better than we even expected when they began to be developed. Second point I want to drive home is vaccines are safe. We have a lot of good data now. We have millions of people that have received these vaccines. Each one of these vaccines went through rigorous testing to make sure it's both safe and effective, with tens of thousands of people participating in the studies. The Food and Drug Administration did not provide emergency use authorization until they had at least 2 months of data on at least half their participants, which is tens of thousands of people. And even over time, there continue to be numerous systems in place to monitor for rare side effects. Some of those side effects have been picked up through these systems. I think it shows the strength of our vaccine side effect surveillance systems, that they can pick up on even some of these very, very rare side effects. And I want to emphasize that they are rare. Last point is just emphasize that they're free. I think everybody on this call probably knows this, but anybody can go in, they can get it. Do not need an ID to get a vaccine either. For people who have insurance, there could be a charge to the insurance provider, but that cost is not passed on to the person receiving the vaccine. It cannot be. And even if you have insurance, nobody is going to get billed for this. So to kind of wrap up with a couple slides on access, and then maybe we can get to Q&A. I think there are a lot of things that can be done to increase access for employees. The first is just providing, most basic information, right? Vaccines.gov is an excellent resource to connect people to, doctors and pharmacies, walk-in clinics in their area. A lot of these places now, particularly outpatient clinics, have access to the vaccine early on. If you recall, there were mass vaccine testing or vaccination sites. They weren't as readily available in particularly more rural communities. And that has changed a lot now with better distribution. Some areas still have transportation to vaccination clinics and childcare resources. And on-site vaccination clinics, if you have not considered doing one, they are a great way. It's at least in survey, it shows employees generally prefer having on-site vaccine clinics. And DHS actually has a matchmaking process that we can talk about a little bit more to match up employers with vaccinators in their local community to make that process as seamless as possible. In terms of reducing barriers, paid leave has consistently been shown to increase vaccine uptake. I think people are concerned about maybe having to take a day off if they have side effects, particularly from that second dose of the vaccine. Providing transportation to offsite vaccine clinics if they are being done offsite. And I just want to point out, and we're going to see a lot more messaging as we work with WEDC, for small businesses with under 500 employees, there is a federal tax credit available to those employers for any employees that need to take time off for vaccination, either for the vaccine administration itself or for any sick leave from any side effects that they may have afterwards. These tax credits, though, are expiring very soon. That'll be coming to an end at September 30th. So I just want to point that out. Incentives, again, something we're seeing a lot of companies do. They do appear to work, and we've seen a kind of a range of incentives that have been used. And as you probably saw the announcement from the governor recently, there's now $100, of course, gift card available to people who get vaccinated before Labor Day. The last is, employers take a lot of different approaches to vaccines with their workers. For employers that aren't going to, say, have a vaccine requirement as a condition of employment, it is recommended and seriously considered to do routine testing for those employees who are not vaccinated. That is a way to, it's not perfect, it's by no means a substitution for vaccination, but it is a way to pick up on those infections as early as possible before they have a chance to spread wider within a workforce. And then again, just touching on vaccine requirements, just to let people know, because there's a lot of news coming out right now. Pfizer is fully authorized now by the FDA. I think that was a point that a lot of people were holding up on when they were considering requiring vaccines for their workers. I think that kind of clears any of the legal concerns aside at this point now that it has the full authorization, full licensure from the FDA. So I just talked very fast, Rebecca. I think we're about 15 minutes in. I think I'll stop sharing my screen there and happy to kind of dive in on any of those points.
Yeah, I think that was a fantastic presentation. And the things that I really took away from that were right now, we are in a situation that is, actually I saw today, we have as many Americans hospitalized with COVID-19 today or more actually than we did at this time last year. So for context for people, this is a very serious outbreak with very serious consequences. And some of the options that employers have now are helping to make vaccines accessible, or even taking the step of making them required, having a workplace testing protocol in place, making sure folks are supported in taking their time off, and also masking procedures to limit the spread in workplaces. So as I mentioned at the start, we do have a number of questions that were submitted in advance. So we're going to begin with those right now. As I share my screen, I'm a little less confident than Dr. Meiman at this, but here we go. The first question from a WCMA member is, can vaccinated people be as easily infected with the Delta variant as unvaccinated people? And do we know how likely breakthrough infection is?
Yeah, I'll try to simplify this as much as possible, but I'll kind of preface this with there's still a lot that we're learning very quickly right now. There are kind of two things going on in parallel, and it's very hard to tease out. One is, as I mentioned when I was talking, there's kind of a cohort of people right now that may have declining immunity because it's been many months since their first vaccination. The second part is we have a new variant circulating as well. So some combination of those appears to be increasing the risk for breakthrough infections in people who are fully vaccinated. So that does happen. That is expected, and that's always been expected. However, we have fairly good data, though, at this point that it is, people who are vaccinated are still much less likely to get infected at all. How much less likely? We're going to get better information on that. The estimates vary quite a bit, but so far it's holding up fairly well that the vaccines prevent and still do a good job preventing infection, although we may be seeing a few more people having breakthrough infections than we did before. I kind of go back to the point I made at the beginning, which is, these vaccines are highly effective at preventing serious illness. That's really what we want to do, is keep people out of the hospital. And as you pointed out, Rebecca, as we're seeing here in Wisconsin, unfortunately, I think we're just on the beginning of an uptick of a fairly large surge. We never thought it would be potentially as large as it was last fall and winter, but that's certainly within the realm of possibility at this point.
Another question. I've heard that vaccinated people actually pose a larger threat when it comes to spreading the Delta variant. Is this because they might be more casual in adhering to mask policies and other precautionary measures?
Yeah, I'm not familiar with where that's come from. I haven't heard that before.
People talk. Dr.
I'm sorry,
Meiman.
people talk.
People talk.
Yeah, it may be linked back to concerns about breakthrough. And yes, and when people do have a breakthrough infection, particularly with the Delta variant, they may have levels of virus such that they can spread it to others. However, it appears that in people who are fully vaccinated, they shed for a much shorter period of time, so they're much less likely to give it to others.
That's encouraging news. Do you have any new insights as to the best face mask to guard against the Delta variant? I have to give you some context here. I heard from a couple of members who said, we went in for our normal back to school appointments and my kids had to wear those paper masks. And are those better? Is that why the hospital's using those? And I suspect it's about control and making sure there's a uniformity, but you answer, you're the expert. Do you have a favorite face mask to try to prevent spread right now?
Your favorite mask?
I would go back to wear a mask, right? So that's kind of bottom line, right? Is some sort of face covering is better than none. Now, that doesn't mean they're all created equal. CDC has some really good information on what type of masks for people in occupational settings or kind of the general public are best. Multi-layers typically work really well. Healthcare settings are a different situation where you may be working in very, very close contact with people who are actively sick. So there's a little higher level of PPE is often used in healthcare settings. So that's why you see that difference. But yes, I would refer people, rather than kind of get into the details, Rebecca, I can send you some information on masks and what the best ones are. The good thing is a lot of these surgical, in fact, I have one right here. This is from my work because I still see patients. This is a standard kind of surgical mask. A lot of these work very well, and they're now more readily available than they were because we're out of the shortage that we had.
That's great to hear. So again, the bottom line here is wear a mask. Consider double masking, but any mask is better than no mask.
Correct.
All right. Will the booster shots this fall protect our employees against the Delta variant?
Yeah, I think we kind of touched on this a couple of times. Yep. So we're kind of moving toward a point. It hasn't been kind of officially recommended by the FDA and CDC, but we're approaching that point where it's going to be recommended for a booster. That's because in some of the early studies that we've seen is that that booster gets antibody levels up to a sufficient level that it appears to provide very good protection against the Delta variant, and also boost them up from where they were before as they begin to decline. So yes, it appears that they will be effective, and that's why we're kind of moving that direction nationally.
That's great. I did have a related question that I'm going to sneak in here, Dr. Meiman, from the group, because I think that it really dovetails well. We had one member who asked in the chat, are the vaccines created equal? Are they all providing relatively equal protection against the Delta variant?
It's really hard to, the nuanced answer, which is probably not necessarily the most satisfying, is it's very hard to compare between vaccines. There was a lot of talk about that when kind of all three came out with emergency use authorization at the same time. But each of those vaccines was tested at different times in different populations. And so kind of looking at lining up their effectiveness side by side does not provide you necessarily a very good comparison. I think what you will see, and there was a news article, I think just today or yesterday, about Johnson & Johnson potentially considering a booster. So I think each of the drug companies that's producing the three vaccines is going to be coming out with data on when a booster is needed and how much protection it'll provide. I can tell you, when they were all received that authorization, they all provided very, very good protection against serious illness. So yeah, the bottom line is no matter which vaccine you get, it's going to keep people from getting seriously ill.
Thanks for that insight on the fly. Another question that was pre-submitted: if one of our employees notifies us that they have COVID-19, and as you just said, it's the Delta variant if you have COVID-19 right now, should their close contacts at work quarantine? What if the close contacts are vaccinated? What if the close contacts were masked? So there's a couple of scenarios here that I think also would help an employer sort of guide their own policies for what mitigation strategies they'll put in place. What's the best scenario here?
Yeah, so the best scenario is everybody is vaccinated. So there is no recommendation to quarantine if somebody's been a close contact, if the close contact is fully vaccinated. So that is another benefit of vaccination. Now, if you're fully vaccinated and you've had close contact, it's still very important to get tested. That's been a recent change, to get tested and to monitor for symptoms. And if somebody is fully vaccinated and they get mild symptoms, then they need to kind of get tested and remove themselves from the work environment. So vaccination has a lot of benefits. And I think one of the other ones is if they do have close contact, then they do not need to quarantine if they've had a close contact at work. Now, if they are unvaccinated or not fully vaccinated, then yes, quarantine remains the recommendation. After somebody is exposed, if they don't have any sort of antibodies from full vaccination, then at some point in the next few days, all the way up to 2 weeks, they could develop symptoms of COVID-19 and begin potentially spreading that at work before they've even known they've gotten sick. And that's the rationale for quarantine.
Okay. I do want to drill down on one scenario there. Is there any difference if their close contacts were masked? Or is the difference maker really whether they were vaccinated or not?
Right. The difference maker there is whether they were vaccinated.
Okay.
The close contact definition differs a little bit in healthcare settings. They are, it's a different environment with different levels of training, different levels of PPE. So typically the masking doesn't make a difference. It's the vaccine that makes the difference.
Okay. Next question. Do we have any idea when we'll reach herd immunity in Wisconsin?
Yeah, I saw this in the question you sent ahead of time. Yeah, there's been a lot discussed about herd immunity, and just for folks who didn't ask the question on the call, I mean, the idea behind herd immunity is you get to a certain point in which enough of the population is either immune from previous infection or immune from vaccination. The virus has nowhere to go, that it can't spread to anybody else. That's going to be a real challenge, I think, and I think most public health professionals are of the same mindset at this point. This virus is so widespread and it's throughout in the entire globe, that without getting to a very high level of vaccination, it's going to be very hard to reach herd immunity. That can be kind of a dispiriting answer, I think, for a lot of people. But I think the point is that with vaccination, we will get to a point where we can learn to live with this virus, that we will not be living through the surges that we're seeing now and that we saw last fall. The key is to make sure we get people the best protection we have from vaccination. If the virus remains around and people are vaccinated, even if it continues to circulate, the risks to us are going to decline. So that's really what we're shooting for.
All right, one more that was submitted in advance, and I do have a couple others that have come in through the chat. How long should we expect to be dealing with COVID-19? I think this is a very related question. And are more variants likely?
So we could be dealing with this for quite a long time. As I said, it's, we have so many cases here in this country and around the world that it's going to continue to circulate, barring vaccination campaign, but it gets almost all of the population fully immunized. That's going to be a very, very hard bar to reach. Are more variants likely? Most likely there are, right? So variants emerge naturally, right? The more times a virus has a chance to replicate, the more chance you're going to get a mutation. Those mutations happen not infrequently, and oftentimes they don't really mean much for us in terms of our health. Occasionally, like what we have with the Delta variant, a virus picks up a mutation that makes it much fitter than the previous version of the virus, makes it either spread more easily, makes it cause more severe disease, or a combination of the two. So unless we can get transmission down, and I think we can, if we can get transmission down to a low level, with really robust vaccination, the fewer opportunities the virus has to replicate, the much lower the chance it is that variants are going to emerge that are going to be a serious risk.
It's really helpful information. I do want to just breeze through this, and then we're going to do the other chat items. We do want to make you aware that there are, of course, additional resources, and that's as simple as a Google search, right? But we do want to be getting information from sound, science-based sources. And so we do want to, again, recommend employers visit the CDC's Essential Employer Toolkit. This has been updated in the last couple of weeks, actually, to add new employer best practices related to the Delta variant, and resources for you on vaccine policies, vaccine mandates, vaccine exemptions, information about how to run a vaccine clinic on site or in your community, and information on how to build vaccine confidence. I think that these materials are excellent and helpful, particularly if you have any sort of human resources role in your work. And we also want to encourage people to make use, and particularly for those of you in Wisconsin, the Department of Health Services COVID-19 resources site, which continues to be updated on a very frequent basis. These are great resources, and we are also a resource for you. So call on us if you have specific questions. And to that end, let me dig into the chat, because it was blowing up. Does having COVID in the past count as natural vaccination? This is an argument we get from some employees.
No, it does confer some level of protection because you are going to develop antibodies. However, it does not provide nearly as good protection as the vaccines. And as we're seeing, somebody who got infected a year ago, their antibody levels are likely declining very rapidly. So vaccination is the only way that we can give somebody immunity or protection in a way that we're highly confident that we're going to keep them from getting seriously sick.
I have a question. Are there any rules or restrictions on how to time COVID vaccination versus a flu vaccination? Can they be concurrent, or should we develop a waiting period?
I believe that just changed. Let me get back to you on that specific question, because that's changing, I think, at the moment. So let me jot that down, and I can get back to you on that.
Great. So folks, everybody on this call will get an email from WCMA with the answer to that question. We'll probably also include it in a newsletter, so everybody has access to that guidance. I know the answer to this question, but I'll have you field it. Does the Department of Health have any programs that go out to local workplaces and talk about COVID and the vaccine? Lots of misinformation, and we'd like to help with that.
Do we have any programs for that? We do. There's
Yes.
a lot of it's based around community outreach, so it's not necessarily employer specific. That doesn't mean that we can't do it. And we work very closely with our local health departments. I know at least the ones that I interact with frequently, they're more than willing to go out and talk to kind of any employer that really wants to bring some of that outreach and education there. I think they're more than happy to do it. So I would start with your local health department, your jurisdiction. They'll have somebody that's very knowledgeable who can come out and talk. Alternatively, local healthcare providers, I think, are an excellent resource. The local health department can also point you to a local doctor or nurse who would be more than happy to come in and provide some education. Sometimes having somebody from the local community just works a lot better, I think, than having somebody from the state. It's just kind of nice to have somebody come and talk.
And I'll tell you right now, anybody on the call that wants to have that happen, WCMA is very happy to help you make those connections and get that presentation scheduled soon. So give me a call, send me an email, and we'll help you with that. Dr. Meiman, can I ask you, could we impose on you for 2 more minutes? I have one more question that I think folks would like to hear the answer to, and it's the question that I hear most frequently. Can you please explain again why we need to wear a mask if we've been fully vaccinated?
Yeah, so the mask is to protect yourself and it's to protect others. So the way this virus is spread is through droplets that come out of our mouth and our nose. A mask does an excellent job at keeping us from spreading those droplets to others. It kind of traps them here. Additionally, mask does provide some level of protection to keep you from inhaling infectious particles that may come from somebody else. So it's for you and it's for others. And that's really the kind of the key message on masks. I know there's been a bit of a whiplash, so to speak, with the kind of the changing in masking guidance. I think when we have this much transmission of virus this widely in the community, kind of universal masking is really going to be a really important prevention measure in addition to everything else. There's no one thing that's going to work perfectly every time. We have to layer on prevention strategies together to get that kind of maximum level of protection.
And I'm going to summarize our final 3 questions into one, and it's about rapid testing and how they can implement these programs in their workplaces. Is there guidance for how to run these programs and resources for how to access these tests beyond what you could pick up at your local Walgreens?
Yeah. So we have, and I'll send this to you as well with the kind of the other information about concurrent vaccinations. We do have a guide about preventing from DHS about preventing COVID-19 in the workplace that talks through using some of those rapid tests in the workplace. If you're looking for a little more granular information, we can point you to some of those resources as well. Testing is not, it seems daunting at first, kind of logistically to set up, but it is something I think with a little bit of background and reading can be done pretty readily. And I've talked to some some larger food producers that have done it very effectively, been doing it for well over a year.
It's encouraging to hear. So, so folks, look for a couple of follow-up pieces from WCMA and from the Department of Health Services after this webinar is over. We'll try to get something to you in short order. And for anybody who may be watching a recorded version of this, please reach out to WCMA for that additional information. With that, having reached our time, I just want to thank Dr. Meiman for your care, for your dedication to your important mission, and for taking time to share your expertise with us today. I can tell you that this industry is dedicated to protecting its workforce and maintaining operations. And so we value your partnership in that effort so very much. Thanks to all the WCMA members who tuned in today too. We had more than 75 here live with us today, representing more than 60 companies operating in Wisconsin. So we thank you for your commitment and your important work as well. Take care and have a good day.
All right, thanks.